Good afternoon, welcome to the Keystone Chiropractic blogcast. So today we're going to be answering one of your most common questions, which is what's the difference between what you do as a structural chiropractor and what most people do as a traditional chiropractor? Well, a lot of the answers really have to do with what we do in this room, which is our examination room. So you can see in this contraption behind me, along with my lovely fiance over here, she'll be our lovely demo girl today, is we have our structural radiographs that we take to get a very unique three-dimensional picture of the upper cervical spine. So through this device, we basically have the patient seated in this chair so we can control their movements, and we have these head clamps to make sure that minimizes how much movement the patient has to go through, so it saves us a lot on having to do retakes and also gives us the most precise image available in chiropractic. So we take an image from the front, from the side, and from the top of our head using this sophisticated imaging tools. The next part of what we do is we actually take a look at their structural integrity using this grid and these bilateral weight scales. So Chad's going to go ahead and stand up for me. And we're going to have her stand up on these scales. And basically from this view we could actually see which side of your shoulder is going to be higher than the other and which side of our hips are going to be higher. We can also see if the head is going to be leaning one way or the other, and we're also going to get some very precise measurements so we can compare where someone is before they start getting corrections versus where they are after the fact. Go ahead and step off there. And one of the last things that we do is we do a thermographic imaging scan of her cervical spine. So that basically means we're getting heat temperatures of her neck. Heat temperatures give us an idea of what circulation patterns are doing in the head and neck, so it gives us an idea if the adjustment is changing things that are happening inside of her from a physiologic standpoint. And it can just be as simple as taking this heat reader and just rolling up and down her spine and getting a series of readings on that to measure consistency. So everything that we do with structural chiropractic is very measurable and is very precise, and that's what helps us deliver a very precise correction so that people can get better from the adjustments rather than having to rely on the adjustments to feel good throughout their time.